Good afternoon, ladies and gentlemen, and welcome to your program, You and Health Ed, on Quinoxe Radio Multimedia, where we have the platform to discuss health-related issues. And for presentation, I am Isia Luciliengu. Caring for elderly individuals present challenges for families and also caregivers, often leading to physical, emotional, and also financial strain. Recognizes these challenges, we have a geriatrician here in the studio with whom we are going to be addressing these issues. But before I introduce my guest or our guest for the day, with me here is my co-host Immaculate Fogwe. Good afternoon.
Good afternoon to you, Lucy. Good afternoon to you, Doctor.
Thank you.
And good afternoon to our millions of listeners and televiewers. Thank you for joining us.
Thank you. Very always a pleasure, Immaculate Fogwe. And our special guest for the day, she's a geriatrician and she is no other person than Dr. Ginette TUAYON, if I'm pronouncing the name very well. Good afternoon, Doctor.
Thank you.
Always a pleasure having you because it's not your first time being here.
The first time, I don't think so.
It's not the first time.
No.
All right.
I already there.
You have been here. Thank you very much for always honoring our invitation. We'll go straight away to our first question. We want to understand what are the most common health issues you encounter with elderly patients?
Elderly patients often face a range of health issues due to aging. Some of the most common include chronic disease like hypertension and diabetes and arthritis. Arthritis is very frequent in elder person. You have also cognitive decline with dementia and mild cognitive impairment. Alzheimer's disease is the most common disease in the world. It attends more than 30 billion persons in the world now. After you have cardiovascular issues like heart disease, like stroke of heart, angine de poitrine, and stroke for the brain. You have also bone and muscle problems like osteoporosis, sarcopenia, which leads elder person to lose all their muscle and their weight. You have also mental health issues like depression, anxiety, vision and hearing issues also are very, very frequent. Cataracts and glaucoma and the hearing loss. You have also respiratory issues, chronic obstructive. Respiratory issues with chronic obstructive pulmonary disease. And you have also urinary and bowel problem with incontinence and prostate issues. Don't forget falls and injuries and weakened immune system. You see that other person have a lot of health problem
that you encounter on daily basis. And now, what does aging impact overall health, or how does aging impact the overall well-being of an elderly person?
Aging has a significant impact on overall health and wellness, affecting physical, mental, and emotional well-being, like you said. While the effects vary among individuals due to genetics, lifestyle, and environmental factors, you have here common ways aging impacts health. In physical health, you have reduced organ function. Many organs, such as the heart, lungs, kidneys, lose efficiency over time, which can affect overall stamina and function. You have also weaker immune system, bone and muscle loss. You have joint problems that are very frequent, joint problem, chronic condition, diabetes, hypertension, cancer increases with the age. Memory and cognitive decline. Memory decline is a very, very difficult problem with elder person. Sensory change, vision, hearing, taste, mental health, resilience and wisdom are better in elder person. You have also social isolation, interpersonal connection. You see that when people take age, they begin to lose their friends, their family, and at the last time of their life, they can be alone in their home. So you have a lot of conditions for age on the overall well-being and wellness.
Okay.
Now,
Well-being and health.
Doctor,
Mhm.
AC Lucy Liengo in her introduction earlier explained that it can be very quite challenging to take care of these elderly persons. I would like to know from you, how often should people taking care of these elderly persons carry out screening and checkups for their victims?
How many?
How often should these people be screened, or let's say checkups be carried out as far as taking care of elderly persons are concerned?
Yes, it's important to do regular checkups and screening. It's extremely important because it play a crucial role in maintaining health, preventing disease, and managing chronic condition effectively. You have early detection of health issues to detect this chronic disease, hypertension, diabetes. They should do blood sugar tests every 3 months, cholesterol tests at least once a year, kidney function, eye function, ear function. So normally every function of body should be checked at least once a year, but some function should be checked like every trimester and like every week.
Now that they have a lot of health complications, are there some medications these elderly persons need not to take?
Yes. You know, elder person, sometimes they begin to take a medicine early in their life, and often family and they don't know when to stop certain medicine. So you see them after 1 year, 2 years, they continue to take a medicine which is not necessary. So it's important to go to the physician, geriatrician, neurologist, and other generalist doctors to check, to do medication assessment, to see what is they should continue, what they should stop, what they should add in their prescription. Some of old people have polypharmacy, polymedication. Yes, it's true. They have also polypathology to polymedication. But for a disease like these two, hypertension and diabetes, some of medicine act on the two disease. So sometimes it's not necessary to take 10 medicine. We can easily stop reduce the number.
All right, before we continue, Doctor, we would like to give out the numbers for those who want to participate on today's edition. We have 670-547049, 670-547049, or 65662-2222, 656-62-2222 at the end. And back to you, Doctor. What are some dietary recommendations for elderly individuals?
A diet for elderly individuals should have macronutrients. Macronutrients are protein. Protein are important to help maintain muscle mass, support immune function, and repair tissue. And lack of proteins lead to sarcopenia, which is the loss of muscle, and it's a difficult problem because it favorizes falls and injuries. So they should they should eat a lot of protein. You find it in eggs, fish, beans, lentil, tofu, nuts, and egusi also. They should eat healthy fat. You know, you have healthy fat and unhealthy fat. Yes, they should.
Example of some of these healthy fats, please.
In healthy fat are some called omega-3 and omega-6. You have it in olive oil, colza oil, tournesol oil, avocado, mackerel, mackerel, all these fish, fat fish. Fat fish has a lot of omega-3 and omega-6. Sardines.
Equally sardines?
Yes.
Now, now you're talking about this healthy fat and all of that. and vitamins.
Yes.
What quantity can I? At what point can I say, okay, this quantity is good for this person?
You know, for the common person, it's not easy to
Identify.
appreciate and identify the right quantity. But in nutrition, we say that an elder person should eat about 1,022 or 1,200 or 800 calories per day.
Yeah.
And this balance is switched on in all the meals of the day. So I can't say exactly the quantity, but
Okay.
it's like 30 grams of protein every day.
Okay.
And you can have it in 2 eggs like that, or 100 grams of meal like that. And milk also is very important for elderly person. And calcium, they should eat calcium. You have calcium in milk, in little fish, in the gambas, this kind of meal.
Okay.
So, what are some key components for us to understand? You have mentioned some already, but what are those key components for we to know that the elderly person is having a balanced diet?
Key component?
Yeah. We have carbohydrates, protein, and the rest. What are the key components that we should ensure that an elderly person has a balanced diet?
The key component, the portion, the meals should be balanced.
Exactly.
Yes, no a lot of fat, no a lot of protein, no a lot of water. You should access to a balanced diet include all the macronutrient and micronutrient and vitamins and minerals. The most important mineral for elderly are vitamin D, minerals, vitamin D, vitamin B12, B12, vitamin A, C, and E for immune system. Also, the minerals like selenium, iron, zinc, and other minerals like iodine, cobalt, to support immune system and decrease the alteration of function in the heart, in the body.
In the body. And now, doctor, we are talking about a balanced diet. We would like to know, for example, for a day, what is the breakfast? What should the breakfast consist of? Yes. Let's start with the breakfast. For an elderly person, what should the elderly person eat during his or her breakfast?
You know, answer to this question is a bit difficult because every person has his preferred choice, has his meals he wants, he doesn't like. So it's difficult to recommend the same diet or regimen for everybody. It's not easy, but you can the component, the main roles are small portion, but a lot of portion in the day, like 4 meals in the day, not just 2 big meals, but 4 or 5 meals in the day. And in every portion, yes, you should have proteins, you should have also fat, healthy fat, and you should also have you should have protein, fat, and carbohydrate for energy.
Doctor, we are in Cameroon, and we know a lot of us have our African meals which we love eating.
Yes.
And still on that case, imagine I come with my 80-year-old mom, and I want you to do some recommendations for me on how I could feed my mom. Your own perception. I would like to know from you, what should I give my mom in the morning as breakfast, lunch, and supper? Let's just take for a day an example of something that we can say it's a healthy meal for an elderly person.
Okay, so for the breakfast, you can give her yogurt, bread, not especially complete bread.
Okay.
You can give her white bread, no problem. You can give also beignet.
Yeah. Puff.
Yes.
Puff rolls. Puff
Yes.
rolls. Yeah.
Yes. And beans, red bean or white bean in the morning. Don't forget a cup of milk.
Okay.
You can give also after this portion a fruits. Fruits are very important for elder person. At for the lunch, yes. Maximize with vegetables.
Okay.
Every vegetables are good for elder person. Carrots, I don't know the name in English, so I'm very sorry.
Say in French, we'll
okay,
try.
Poireau, celery,
Leeks, yeah.
yes,
Celery,
cucumber,
yeah.
Poivron,
green pepper.
yes, all are very good because these vegetables contains a lot of minerals
Okay.
which support the immune system and joints and muscle and bone system. It's very important. And the a tip I give to my patient is to add a spoon of healthy fat in the plate. No cook with this fat, with this oil, like colza oil. Colza oil is a very good oil, but you can find it in the
supermarket.
Yes, supermarket.
Okay.
Yes, colza oil, tournesol oil also, but tournesol oil is not very good like colza oil.
Right.
So you can add just 1 or 2 spoon in the plate, and in the evening, no a big portion in the evening, just something like eggs or a yogurt, and you can add also fat oil in the yogurt. You know, with the age, sometimes they don't want to eat. So you can give a pot of yogurt and add oil and grains in this. You know, grain de lin, grain de chia. I don't know if you know it. Yes, it's it's rich in proteins.
Okay.
Yes, healthy and rich in protein.
Now, doctor, you have talked about what they should eat. What are some of the things elderly persons need not to eat now?
Yes, it's for not older person. It's for either adult. Adult, yes. Avoid or limited a lot of carbohydrate. A lot of carbohydrate is not good, especially refined carbohydrate, like in bakery.
Cups, yeah.
Yes, biscuit.
Okay,
Yeah,
biscuits, yes.
Yes,
cakes.
yes. Avoid it. Avoid also a lot of salt.
Okay.
Because salt leads to hypertension. So it's not good.
Sugary foods that can lead to diabetes equally. They are good to be avoided.
Yes, yes. Limited salt, limited very sugar drinking.
Yeah.
Okay.
Yes. Prefer teas. Coffee is not bad. But they can prefer teas, tisane, and infusions.
All right. Thank you very much, Dr. Ginette and TUAYON. She is a geriatrician, and of course, we were talking about what elderly persons are supposed to do, especially when it concerns their diet, what they should eat in the morning, the afternoon, and of course in the evening. And for co-presentation, I was with Immaculate Fogwe. Thank you very much, Ima.
A pleasure shared.
And for presentation, I am Monsieur Lucille, and we received technical assistance from Bertrand Bonsini and Jonathan Babiola. Ladies and gentlemen, stay tuned to programs on Equinox Radio and of course television. Bye bye for now.